And it may not be possible to get everyone off medication. I'm not against people using medications.
Yeah.
It is necessary a lot of the time, but it's about reducing their long-term reliance. Generally, what I saw within my sort of chronic clinics, I start people on a sort of baseline DMARD, something like methotrexate. They do okay for a period of time, but they don't completely get better. And after so many months, things deteriorate. So you increase the dose, and then you add in something else, and then you escalate them to biologics. I think without addressing all these other factors, what we can expect from medication is limited. And to have really optimal health in these patients, we probably need to be doing both.
I'm Shreya Parekh, and this is Empower Her, the podcast for women over 35 who want to take control of their health and wealth. Join me and my guests as we share insights, resources, and ideas to help you break free, learn more about yourself, and live your best life while closing the gender gaps. Hit follow to stay connected and sign up for free emails on the Empower Her website to supercharge your journey. Did you know that chronic diseases often go misdiagnosed in women? But what exactly do we mean by chronic disease? Today, we're diving into this crucial topic with Dr. Kerry Aston, a seasoned medical doctor and consultant in rheumatology with over 15 years of experience in the NHS. Dr. Aston specialises in arthritis, autoimmune and inflammatory conditions. Her dedication to promoting health and preventing chronic illness has also led her to explore sports and exercise medicine and pursue advanced training with the Institute of Functional Medicine. In this insightful episode, we'll unpack the complexities of menopause and discuss actionable ways to advocate for better healthcare. Kerry, thank you for joining me today. I'm really excited to have this conversation because I think it's a topic that I haven't covered at all, and it's super important that we talk about chronic disease and chronic illnesses. Could you please talk a little bit about your journey from what you were doing to what you're doing now? That would be great. Thank you so much.
Hi, thank you for having me on to chat today. I'm quite excited about this. I'm Dr. Kerry Aston. I'm a consultant rheumatologist with over 15 years experience working in the NHS, where I specialised in autoimmune disease and conditions affecting the joints and connective tissues. So I suppose over the years, I've really treated patients with chronic autoimmune conditions like rheumatoid arthritis and lupus. And while medication is an absolutely crucial part of the treatment, I've always felt drawn to understanding how we can support their health sort of beyond prescriptions. On a personal level, I've always been really passionate about fitness. I'm a bit strange. I love long distance running. I love lifting weights, and I love just seeing how far I can really push myself. And I think that interest led me to further qualifications in sports and exercise medicine, personal training and rehabilitation, because I just wanted to be able to explore how exercise impacts our overall health and how we can use that as a tool for managing chronic conditions. So sort of working with patients, I really began to see how those lifestyle factors like what we eat, how we move and how we manage our stress, they play a huge role in our health outcomes. And I suppose that as well sort of led me towards functional medicine, which really looks at the root causes and focuses on a more holistic approach. I suppose over the last year as well, that shift led me towards Nexus. So I'm now a co-founder of a women's health startup company, and we are building a platform to help women manage their own health proactively and provide tools for sort of nutrition, menstrual cycle tracking and exercise programming, all tailored to their individual needs. And we're sort of working towards getting that AI enabled to really give those personal insights and recommendations. So that's a bit about my journey, what I'm passionate about. And yeah, I'm looking forward to see what else we're chatting about today.
That's great. I mean, that is a lot of stuff that you're doing for sure. I mean, being a consultant is a huge job as it is, and also incorporating all the other aspects, which I think you've done because it's so important. It's not just about, as you said, looking at medicine from, I've got this, here you go, take this and you'll be fine, or you may not be fine. You're looking at it from a kind of whole holistic point of view as well, I feel like, which is really the right way to do it, in my opinion. And I'm seeing more and more now that it's so important to look at the whole picture, not just, oh, my shoulder's aching and here you go, take this, or do this exercise specifically for your shoulder. There could be other things going on. So I just want to ask you first and foremost, what is rheumatology? Because not everyone really understands what that is and what that encompasses, and what kind of symptoms would you expect if you have things related to rheumatology?
Yeah, so rheumatology it's a medical specialty where we focus on diagnosing, treating, and managing conditions that affect the joints, muscles, and bones, as well as those more systemic autoimmune conditions. And those are those illnesses where the immune system forms antibodies that attack the body's own tissues. So the more common things that we treat are all types of arthritis, so whether that's degenerative osteoarthritis or the inflammatory types like rheumatoid arthritis, osteoporosis where you get thinning of the bones, and then those more sort of systemic conditions like lupus that can affect joints and other organs then as well. And I think, particularly for women, rheumatology is really important because autoimmune disease disproportionately affect females. Like all of those conditions are much, much more common in women. They can have a significant impact on quality of life, affecting physical function, your mental health, and even aspects of your reproductive health as well. Um, I suppose the difficult thing is that the symptoms are very variable, but they often include things like joint pain, stiffness, and swelling, especially in the hands, wrists, and knees. You quite often hear that story where people are getting up first thing in the morning, they're very stiff, they're very slow to get moving. It takes them, a few hours before they kind of feel okay. They also get quite a lot of fatigue, things like skin rashes, dry eyes, dry mouth, dry mucous membranes. And then there's other autoimmune conditions like lupus. Those symptoms can go way beyond the joints and involve even kidneys and heart, which makes that early diagnosis and treatment really, really important.
Hmm. So, how does this link with inflammatory autoimmune immune conditions, and what are the symptoms of those? Because I feel like a lot of these things are kind of linked up somehow. So, could you explain a bit more about that?
Yeah, so rheumatology, it's really closely tied to that sort of inflammatory autoimmune conditions. And again, this is just where the immune system is chronically overactive, overstimulated, and it starts to produce antibodies that mistakenly attack healthy cells. So they start to attack the joints and the connective tissue and other organs. And that can cause sort of widespread inflammation. Um, with all types of chronic disease, the root cause of this is often linked to those sort of common factors. So chronic inflammation, metabolic imbalance, immune system dysfunction. That chronic inflammation, it's a shared factor in conditions like not just the autoimmune conditions, but things like heart disease, diabetes. And when we look at the root cause of chronic inflammation, there are many different things that will contribute to that, but certainly a poor diet, poor nutrition, lack of exercise, high stress, and even environmental toxins can contribute to that chronic inflammation and tissue damage over time then as well.
So, with you're talking about kind of chronic disease now. So, what classifies it as chronic versus not being chronic?
So I suppose a chronic disease is really a long-lasting health condition that is going to require ongoing management. And these things, they don't just develop overnight. These are diseases that often arise from years or even decades of underlying issues within the body. So even those conditions like rheumatoid arthritis, the psoriatic arthritis, they're chronic because they persist over time. And these things are so common. By the age of 60, about 80% of us will have at least one chronic condition, and nearly 60% of us are going to have multiple chronic conditions. So having one chronic disease is significantly increases your risk of having another one. And that kind of creates that vicious cycle that compounds over time. And so because many of these things then have that common root, that sort of chronic inflammation, that metabolic imbalance, immune system dysfunction. So that's why it becomes easy to see that if we have one, then it becomes easier to develop another. Um, it's also, despite the wealth of information we have about how factors like inactivity, our diet, and our stress contribute towards those chronic health conditions, I think people just remain quite resistant to change. Whenever we are younger, maybe in our 30s, 40s, there's often this sort of false sense of security about your current health. You maybe have some symptoms, but you think, I'm not that unhealthy, or other people my age are more unhealthy. And I think that could be a really dangerous mindset. Waiting until symptoms become a condition or become unmanageable, it can be too late. And these conditions, they really do develop quite subtly over years or even decades. I think as well that so much of our belief is that these health conditions are really predetermined by our genetics. So there's nothing that people can do to prevent them if there's a very strong family history of things.
Yeah.
And yes, absolutely, our genetics are really important, but those lifestyle factors have a much more significant impact on our long-term health, and those things are definitely within your control. Um, I think sometimes maybe as the medical professionals, we can be a bit sort of guilty of reinforcing that passive approach as well. People come with hypertension, diabetes, and they just quickly get put onto medication. We don't do an awful lot of work on sort of helping people with lifestyle changes and helping them to address the root of disease. And yes, I'm not against medication at all. It's absolutely necessary in many people. But just being on medication, it doesn't mean that you are healthy. And treating symptoms with pills really fails to address the underlying factors that are contributing to the progression of those other chronic conditions then as well.
So, I don't know, I feel like with women, like being diagnosed with certain chronic conditions or any conditions really, it can be quite a tricky space. What can be done for women? Like I know, for example, like with menopause, as an example, you think you may have perimenopausal symptoms or some kind of menopause symptoms going on, and you go and see someone. How can you distinguish whether it's menopause or it's something else? Because sometimes the symptoms can be the same, if that makes sense.
Yeah, and I think that can be quite tricky to sort of tease things out. And it's about sort of finding the right healthcare provider, finding the right, or making sure that you're getting the right tests, and finding someone that's listening to this and prepared to spend the time figuring things out for you as well. Um, and I think this whole issue, it's really is compounded by that gender health gap, which is a glaring concern within the healthcare system. I think women are frequently under-researched, under-diagnosed, under-treated, and a lot of symptoms are often dismissed or overlooked. And the differences in how our bodies respond to stress and disease and medications are rarely given the attention that they deserve. Um, like when you look at autoimmune conditions, they say they disproportionately affect women. Nearly 80% of people with autoimmune conditions will be female. Um, but the sort of research and attention that has been given to these conditions and women's health overall, it's definitely lacking. And it's not just a gap in research, it's a systemic issue that spans medical education, diagnosis, treatment, and long-term care as well. So even like throughout my training, there was very little time spent on the specifics of women's health and what happens to a woman's body throughout that kind of perimenopause period. The other thing that makes it sort of complicated is that these conditions, that they're multifactorial. So those hormonal differences, particularly those fluctuating estrogen, progesterone levels, they play a role in hormone regulation and they can predispose women to autoimmune diseases. So it's really common that if you have an autoimmune condition, quite often those will go into remission during pregnancy and flare in the postpartum period. We're also sort of looking at genetic and epigenetic factors alongside sort of environmental factors that can trigger these diseases in the female autoimmune system then as well. I think so many women report symptoms like fatigue, joint pain, brain fog, and sort of like irritable bowel symptoms, and they're really frequently dismissed. Many women are told that their symptoms are psychological or stress related. On average, it does take a woman, 5 to 10 years to receive an accurate diagnosis for an autoimmune condition. And often by the time that diagnosis is made, they may have significant tissue damage or disability. And that is particularly troubling because we know that early diagnosis and treatment can significantly alter the course of these autoimmune conditions and preserve quality of life in the long term. So yeah, I think it's really important just to recognize as well, like that perimenopause period when we start to get those fluctuations in estrogen and progesterone. Yes, it can be symptoms of perimenopause, but to be really aware that those fluctuations themselves, this is a really pro-inflammatory time for women's health, and those changes can trigger other conditions as well. So that's when we start to see things like osteoarthritis flaring, other sort of like stiff joints, painful joints. So the sort of the hormonal imbalances can trigger those other conditions and contribute to them as well.
So yeah, I feel like, obviously all women will go through perimenopause, menopause, postmenopause. Now, when you're getting diagnosed with that, or whether it's something else, I feel like you're kind of saying that with some of the things that aren't related to menopause, you can prevent that perhaps, if you, like in your youth, like in your 20s, 30s, maybe even 40s, if you've got a niggle somewhere, that can be preventable, rather than you leaving it and thinking, oh, that's fine, I'll just wait it out, or, I'm still young and active. By the time you're in your late 40s or 50s, 60s, that could develop into something quite chronic. Can a lot of these things be prevented, especially things like rheumatoid arthritis? Like, I feel like a lot of conditions are kind of said, oh, it's inevitable you're going to get this at a certain age. And these are the kind of things I hear a lot.
Yeah, and it's interesting because I suppose even like during my own medical career, you get someone with a new diagnosis of rheumatoid into the room, and you basically tell them, it's probably in your genetics. There's some things that, sort of infective factors, environmental factors that may have triggered this, and then we tell them that their condition is not curable and that they will be on medication lifelong. And I think that we are missing a big part of the picture here. And that is kind of what drew me towards functional medicine then as well. So it's really looking at the root of inflammation, or the root of disease, and where this inflammation is coming from. When we use medications like DMARDs and biologics, we're really just sort of suppressing the inflammation. We're not actually treating where it's coming from. So, like, I wouldn't say that certainly everything is preventable, but if we are doing all those other things, like we are really looking after our gut health, if we are trying to reduce our exposure to environmental toxins, if we're able to manage our stress really well, it takes a certain set of conditions to trigger an autoimmune disease. You probably have to have the genetics. Poor gut health definitely comes into that as well. And then you have to have something that's going to trigger it. So whether that is a vitamin and mineral deficiency, some sort of infective agent, or some sort of environmental toxin. So you kind of have to have that, whole sequence of events to kick things off. It's very common as well that at periods of very intense stress, that we will see new autoimmune conditions present, or people who've been very stable for a long time come in with a flare. So while I certainly wouldn't say that things are preventable, I think there are many, many things that we can do and look at that will reduce your risk of these developing. And if you do have the condition, help to improve your management and, your response to medication in the long term.
Yeah, I mean, we can't prevent the menopause, but I feel like we can certainly prevent a lot of the symptoms associated with it if we look at the whole picture, rather than just ticking one off and leaving the rest, because it's not just a matter of doing that. Now, I think when we last spoke, we talked about something called fibromyalgia. That is a completely new term for me. I have no idea. I didn't know what that was. And you mentioned that a lot of women get kind of diagnosed with that, or just kind of fobbed off with that. Am I correct in saying that? And can you kind of go deep into that a bit more?
Yeah, so fibromyalgia, it's another chronic pain condition where patients will have widespread sort of joint and muscle pain. They'll be extremely fatigued, they'll have very poor sleep, and then usually cognitive difficulties as well, like sort of brain fog or fibro fog. And we don't usually think of it as a condition of the joints themselves. It's thought to be about how the brain processes pain signals, and we get this increased sensitivity to pain. Um, other common symptoms with it will be things like, headache, irritable bowel is much more common with it, and then anxiety and depression as well. And again, it's one of those things that we don't really understand quite how it's caused, but certainly genetics are going to play a role. Environmental, so in some people, psychological stress is certainly a factor. And again, this is something that predominantly affects women as well. You know, around 70 to 90% of patients with fibromyalgia are women. And I think that because it's a diagnosis of exclusion, that whenever we cannot easily explain your pain, it becomes something that we label it with. So it's sort of saying to patients like, we don't have any treatment for you. You don't have any sort of serious condition. This is all, you know, there's no medication for this that's going to change the outcome, and the investigation and management kind of stops there. There's not really much further support for these patients.
So how can functional medicine really kind of help with all these things then? Because this is another new term for me, and I've come across it a lot lately. And personally, I think it's fantastic, and I think it should be implemented throughout the NHS. But I don't know if I'll see that in my lifetime, but hopefully my children's lifetime maybe. But
Yeah.
could you talk a bit more about functional medicine and how that can really help with a lot of whether it's chronic disease, but just generally.
Yeah. I suppose just first, like the big thing with fibromyalgia is, you know, that lack of sort of definitive tests, and because there's no specific blood tests, and it's that diagnosis of exclusion, you know, once doctors have ruled out other things, but one, it takes a very long time because patients might see, you know, 5 to 10 healthcare providers before everything is being excluded, so it takes a very long time to kind of get this diagnosis, but you know, just if we have a look at even the limitations of blood work, so those standard blood tests are often sort of normal in fibromyalgia patients, which I think is quite misleading. When we look at blood testing, those reference ranges, those ranges are based on population averages, and those include many people in suboptimal health. So just because your blood tests are within that range, it doesn't mean that you are at your best. They also just give a snapshot in time of what's going on. So it's not looking at trends. It doesn't maybe pick up on things like your blood sugars very gradually rising over time, maybe indicating that you do have some insulin resistance there as well. And your body is very adaptable. So you can like maintain your blood markers within normal limits, even as those underlying issues persist. You know, you might have two people with similar blood sugar levels, but one needs more insulin than the other. So, you know, everybody's body is a little bit different then as well. So I think there's always that really frustrating disconnect between normal blood tests and ongoing symptoms, particularly in patients with fibromyalgia. I think something that I do feel is quite important for chronic pain patients is having a look at blood sugar levels. So chronic high blood sugar, even if it's at, you know, within range, if it's at the higher end of the normal range, it's going to increase inflammation in the body. Inflammation drives pain and heightens that sensitivity as well. So that's going to worsen those pain symptoms. If we've got those higher blood sugars as well, it can have impacts on our energy levels, our, you know, how fatigued that we feel. And that early insulin resistance is associated with nerve damage, neuropathy, and that in itself can cause that increased nerve sensitivity then as well. So I think, you know, the tests that we do, there's definitely limitations within that. And, you know, I always felt that there was a better answer for these patients, and that's kind of, I ended up in functional medicine. So whenever we're looking at chronic pain or fibromyalgia, other things that I start to have a look at are things like food intolerances. So definitely certain foods can trigger inflammatory responses in patients who are sensitive. Things like dysbiosis. So if we have an imbalance of bacteria in the gut, in the large bowel, or if we have that imbalance of bacteria in the small intestine, otherwise known as SIBO, we can get sort of digestive issues, inflammation and pain, and that's all very relevant to particularly fibromyalgia patients as well. Other things like hidden infections, I keep saying our sort of environmental toxins, our toxic burden, but we are exposed to a huge number of toxins on a daily basis, even if we look at things like our washing powder, our soaps or cleaning products, all of those things. So I always have a good sort of discussion with patients about how we can reduce our exposure to so many of those things. They can have a big impact on our hormonal imbalance as well. Um, Having a really deep dive into hormonal imbalance is really important. So not just a blood test for estrogen or progesterone, but seeing how well you metabolize your estrogens, what your adrenal health is doing, because all of that's going to have a big impact on your mood and your energy levels as well. And then other things like mitochondrial dysfunction. So mitochondria are those small organs within cells that produce energy, and certain vitamin and mineral deficiencies, genetic differences between people, um, can all have impacts, and even the likes of post viral infections can all have impacts on our mitochondrial health, and that can lead to low energy and issues with pain then as well.
Would you say functional medicine can really help treat or help, reduce symptoms quite dramatically in anything? As an example, this is going to an extreme now. If you are diagnosed with a cancer, obviously you're diagnosed with the cancer. It cannot take away that cancer from you, but can it help with really reducing those symptoms, or, with rheumatoid arthritis, or with, all these things that we can get?
Yeah, and again, I think it's about looking at that bigger picture, and it's not just prescribing medication. That medication always works very downstream, and it often fails to address the root. Like I'm not a cancer specialist in any
Yeah.
way, but I would certainly believe that anyone who is undergoing cancer treatment, would benefit from some of the approaches from functional medicine, making sure that their diet is optimized, their gut health is optimized, and that we are reducing any of their toxin exposure as well. Certainly so I would tend to see more of the autoimmune patients, and I always, the first thing that I do is with most people is have a good look at their gut health, see what's going on with their gut microbiome. Most of these patients have dysbiosis, some sort of pathogens or infections within the gut, and some evidence of leaky gut then as well. So by addressing that, we can stop that sort of downstream inflammation. And it may not be possible to get everyone off medication. I'm not against people using medications.
Yeah.
It is necessary a lot of the time, but it's about reducing their long-term reliance, because generally what I saw within my sort of chronic clinics, I start people on a sort of baseline DMARD, something like methotrexate. They do okay for a period of time, but they don't completely get better. And after so many months, things deteriorate. So you increase the dose, and then you add in something else, and then you escalate them to biologics. And so many people just seem to have this partial response. They do okay, but we don't always get them back to feeling really, really well. So I think without addressing all these other factors, what we can expect from medication is limited. And to have really optimal health in these patients, we probably need to be doing both.
Yeah. So, kind of leading on to this, really, where do you think that the health and fitness industry is going wrong then, generally?
Yeah, I think for a woman, there's a lot of confusing and sort of complicated messages out there. Um, the industry definitely promotes this mantra of eat less, move more. And while that is effective for some, I think it's a bit of an oversimplification. So many women I see are on these really, really restrictive diets. Like they're maybe eating, 1,200, 1,400 calories a day while working, looking after kids, and doing a job. And it maybe works for a little while, but eventually they, fall off the wagon. They get very fatigued, they get very irritable, and they stop making any progress. And I think these diets, they really set you up for failure because they are framing health as this sort of painful endurance test. And in reality, whenever we really drastically cut calories and nutrients, our bodies enter this energy saving mode. And that just leads to hormone disruption and long term health issues, and decreased performance then as well. I think fasting is another area where people, particularly women, get very confused. Again, we see these very, very short um, eating windows, and maybe doing things like a dirty fast where they're throwing lots of caffeine in on top of these prolonged fasts. And yes, there are some studies that show fasting does have metabolic it benefits for our metabolic health and fat loss. It's not universally beneficial, and I think that is particularly true for women who have hormonal imbalances, particularly during the perimenopause. Um, Personally, I feel that we should be promoting, a little bit more regular exercise over the fasting, and the extreme sort of calorie deficits. Exercise and building muscle is going to improve your insulin sensitivity. It's going to improve your metabolic function, and without that sort of severe stress that fasting is going to put on the body as well. As well as that, it's going to protect our joints. So it's going to make our joints more mobile. It's going to give us muscle that protects our joints and prevents you from injury then as well. And fasting, extreme calorie deficits, you're not going to be able to do that. So definitely, while, fasting might work for a select population, I think it's unnecessary and can be harmful for women who are active and perimenopausal as well. Like I do think we should be giving our body a little bit of rest overnight. And if you're fasting, from 8 o'clock in the evening to your breakfast, 12 hours is absolutely enough to be doing. And that allows you to get the benefits of fasting without compromising your energy levels as well. And I think we just need to focus on, health is something that should be enjoyable. It shouldn't be painful. It shouldn't be difficult. And if we can just balance that or prioritize that balanced nutrition, eat enough food that supports your level of activity, supports your hormonal health, that's going to be far more beneficial in the long run. It's going to be maintainable. It's going to be enjoyable. And I think we just need to shift that focus about how we look, and make it more about how we feel and what our bodies are able to do.
Yeah, no, absolutely. I totally agree with that. I think there's so much information out there now through social media, just whether it's the magazines, whatever it might be, this diet, that diet, eat less, eat these types of foods only, and don't eat this, and don't it's becoming quite crazy actually, and people are getting confused, women are getting confused, and I think from what I've learned from speaking to all the amazing guests I've spoken to, and all you're super qualified, it's a lot of these things are about balance, and also looking at the whole picture and looking at you as an individual. It's almost like kind of like bespoke healthcare really, because one size definitely does not fit all, and people are what you do won't probably work for me. It's not a copy and paste situation. We're two very different people. And yeah, I really think that going for a more bespoke approach and thinking about lots of different aspects is definitely important. In terms of women advocating for their healthcare, what are your views on this? Because I know a lot of women go to their GP for whatever symptom they may be experiencing, whether that's the aches, the pains, whether they're going, whether they're feeling tired, whatever, getting misdiagnosed, or getting told to have ibuprofen or paracetamol, or perhaps even something else, and it doesn't help. How should women advocate for their healthcare and really get the diagnosis that they deserve, really?
Yeah, so I think the way I kind of think about this is like health is not black and white. Health is kind of on this sort of spectrum or sliding scale. And we've got optimal health at one end and disease and sickness down at the other. And a lot of people that you see are kind of just sliding towards that disease. They've got symptoms, but they're kind of vague, and they've got normal blood tests. So it's difficult to classify, and they don't fit into these nice kind of like criteria boxes. And I think whenever people are in that situation, it becomes difficult for your doctor to know what to do. And I think that's when people are feeling like that, that's when the sort of dismissal is most likely to happen. It's like, come back to me whenever you are sick, or come back to me when something else happens. And I think we should be just trying to be more proactive, and help people who are really struggling here before they deteriorate any further. And that advocating for yourself, it just means taking an active role in your healthcare journey. It's empowering you to communicate effectively with your doctor and ensure that your needs and concerns are met and prioritized. And to do that, you have to educate yourself. Okay, so you can't be passive about your healthcare. The more you know, in general, the more you know about yourself, it's going to make you have better conversations with your doctor as well. So familiarize yourself with your health condition and treatment options. Prepare for your appointments as well. So make a list of your symptoms, make a list of questions. It's very easy to get flustered and feel rushed whenever you're in an appointment. So if you're prepared whenever you go in, it can really help with that as well. Don't be worried or scared to ask questions if you're not sure about anything, if you don't understand anything, and express your concerns. So if you feel that you've been given a very quick answer, that your concerns haven't been met or they're being overlooked, then voice them. It's absolutely okay to do this. And you shouldn't feel uncomfortable, and you shouldn't be made to feel uncomfortable doing this as well. If you're not happy, get a second opinion. So that again is an absolutely okay thing to ask for, and a fresh perspective can really help just give new insights on your health. And I think I would just say trust your instincts as well. You know, if you feel that something is not right and you feel that your concerns are valid, don't dismiss those feelings. And it may be, as I say, like getting a second opinion, speaking to someone else, getting some community support, and things like that as well. But definitely your intuition is a key part of understanding your health.
Yeah, absolutely. Don't stop,
Yeah.
basically. Otherwise, well, the thing is, if you do take a back seat and you do just accept whatever's given, even though you know that's not right, it could end up being something quite chronic, and that's the space you don't really want to get into. So I know you're building something. You're a co-founder of Nexus, and I really want you to talk about that because I think it's fantastic as well. And it's an amazing way for women to advocate for their own healthcare. From what I hear, what you're building, it can really help women to understand themselves a lot better, themselves, and not it's more kind of a bespoke thing, which is perfect. Could you talk a bit about what you're building and how it can help women and when it's going to be launched?
Yeah. So yeah, I'm now, I suppose I'm not the only person who is really passionate about sort of women's health and helping to close that gender health gap. And I'm now part of this really fabulous team, and I think we will be able to sort of revolutionize women's healthcare. So we are trying to design Nexus to be sort of your lifelong health companion for every woman throughout your journey through maybe pregnancy, perimenopause. And I suppose even just at a basic level, we're bringing together cycle tracking, exercise programming, and again, that exercise programming is sort of more tailored and personalised to you. You have a choice over days, intensities. There's we have a pregnancy expert who's a friend of mine is going to be doing a programming as well. It's nutrition tracking. But more than this, we are trying to evolve this into something that's going to be AI enabled, really being able to give you those deeper insights and personalized recommendations from the real-time feedback that you're giving it from your health wearables, from tracking your symptoms, from tracking your menstrual cycle. So it should be like having your own personal coach at home that really understands your unique health profile and is able to guide you in real time. So we have had a few setbacks. Our MVP should now be ready to go sort of in December time with a full launch plan for the new year. And yeah, I do think this is going to be a game changer for women's health and a really significant step forward to close that gender health gap.
That's great. Is there going to be kind of early access so people can use it?
We have already, because we were supposed to launch in October, so we already have our early access kind of signed
Yeah.
up, and they'll be starting in December. So, we should have some marketing and things ready to go about how you can get started on this for January time.
Yeah. No, all the details are going to be in the show notes anyway. So if anyone's interested in looking at what Nexus is, it's the links are in the show notes anyway. But I cannot wait to see it because I from what I see so far and from what you're telling me, I think it will be great, because for me personally, there are so many apps out there that, I just want one app. I don't want 5 apps to track my menstrual cycle, and then one for this and one for that. I just want everything in one thing, and it's personalized for me. And this is why I feel like it's going to be a great thing when it launches.
Yeah, yeah. So I think on average, like the average woman has between 5 or 6 different apps that they are
Yeah.
using for their nutrition and for their cycle, for their exercises. So, say at the very basic level, that's all going to be in one place. But when we have this AI enabled and sort of giving you that feedback on your health in real time, I think that's what's going to make the big, big difference.
Yeah, no, absolutely. I can't wait until it's out there. Kerry, thank you so much for being on the podcast. It's been great to have you on. As I said, if anyone wants to contact Kerry, they can see her details in the show notes. But in the meantime, I look forward to seeing Nexus as well and speaking to you again soon.
Yes, thank you very much for having me.
Thank you, Kerry.
Thanks for tuning in to Empower Her. I hope today's episode has left you feeling inspired and motivated to make a positive difference in your world. Please follow the podcast and share it with anyone who will find it helpful. Until next time, keep striving for positive change and greatness for all women.